Let's discuss about this male-related cancer called prostate cancer. Just so you know, I'm Ifeanyi and welcome to Wellness by Nwasike Ifeanyi. Now let's start by discussing what the prostate gland is. The prostate gland is a small male reproductive organ that is located below the urinary bladder and at the front of the rectum. This organ weighs around 20 to 30 grams and it secretes a very important fluid called the prostatic fluid. Now this fluid helps to protect and nourish the sperm. It forms about 20 to 30% of the seminal fluid which forms the semen alongside the sperm. The muscles of this organ help to push out semen during ejaculation. Now the health conditions associated with this organ include prostatitis. Prostatitis is an inflammation or an infection of the prostate. Benign prostatic hyperplasia is a non-malignant or non-cancerous swelling of the prostate. Prostate cancer is a malignant, uncontrollable, abnormal prostate gland cell growth in the prostate. This condition can actually metastasize, that is, it can actually spread to the bones, to the lymph nodes, to the liver, and also to the lungs. What are the causes? Age. People above 50, 65 have higher chance of developing prostate cancer. People who have the family history of it. The race, again, men around the African region have higher chance of developing prostate cancer. Hormonal factors. Hormones like androgen, especially the testosterone, help prostate gland cells to grow. So even when they are cancerous, it's to still help them grow. Another one is obese men. Obesity. Men who are obese have higher chance or higher risk of developing prostate cancer. Men who smoke and drink excessively have higher chance or higher risk of developing prostate cancer. Men who consume poor diets have higher risk of developing prostate cancer. Now, what are the symptoms? Let's divide the symptoms into the early stage symptoms and the advanced stage symptoms. Now, the early stage symptoms: urine related, difficulty in starting your urination, difficulty in maintaining the flow of urination without interruption, feeling like the urinary bladder is not empty yet, and also frequent urination. Sexual related, erectile dysfunction, difficulty in getting or maintaining an erection, hypospemia, reduced ejaculation, dyspnea, painful ejaculation. The blood related, hematuria, blood in the urine, hematospemia, blood in the semen. And then for the pain related, discomfort around the pelvis, dyspnea, that's pain when ejaculating, dysuria, pains when urinating, or burning and painful sensation when urinating. When this condition becomes advanced, it can lead to weight loss, that's a sign, weakness, pains around the spine and the pelvis, leg swelling as a result of the lymphatic drainage being affected. Now let's go into the stages. There are 4 stages of this cancer. The stage 1 is when this cancerous tumor is small and in the prostate. Stage 2 is when this cancerous tumor is large but still in the prostate. Stage 3 is when this cancerous tumor is starting to metastasize, that is, it is starting to spread to other structures. Stage 4 is when this cancerous tumor has spread to other structures like bones, lymph nodes, liver, and also to the lungs. Now, how is this condition diagnosed? This condition can be diagnosed using the PSA blood test, the prostate specific antigen blood test. It can be diagnosed using DRE, digital rectal examination. It can be diagnosed using MRI, magnetic resonance imaging. It can be diagnosed using biopsy, that's the most definitive test. They cut out the part of the prostate gland and they examine it under a microscope to confirm possible cancerous cells. Now, how can this condition be treated? It depends on 4 factors: age, stage, overall well-being, and cancer aggressiveness. First of all, the doctor may do an active surveillance. They actively monitor this condition without immediate treatment. And secondly, they could do a surgery, hysterectomy, surgically removing the prostate. They could do a hormonal therapy. They remove the testosterone level, since testosterone actually helps these prostate gland cells to grow, even when they are cancerous. They could do a radiation therapy. They use high radiation to kill those cancerous cells. They could do a chemotherapy using drugs to kill those cancerous cells. Now, how can you reduce the risk of developing prostate cancer? Poor diet increases the risk. So you eat good diet like vegetables, fruits, fish, and so on. Obesity increases the risk, so you watch your weight, you do lots of exercise and physical activities. And smoking and excessive consumption of alcohol actually increases the risk too. So you reduce or you stop those habits. And then you learn to go for screening. Very important. Even when these cancerous cells or this cancerous tumor develop, you can detect it early and get it treated before they metastasize and become a more severe condition.